Knee replacement is a big deal, and for most people, you get one chance to do it right. In today's video, I'm going to share with you 3 really important tips that I share with each of my patients. Hello and welcome back. My name is Adam Rosen. If you could do me a favor right now and click the thumbs up button below if you enjoy this content, it does help other people like you find information like this. And be sure to click the subscribe button so you get updates when new videos like this come out. I was scrubbed into my first total knee replacement surgery in 1996. And since then, I have been fascinated with the surgery. Over the past decade or so, I've really made it my mission to try to educate patients to make sure that patients know what they're getting themselves into and how to ultimately get the best result from this surgery. So in today's video, I'm going to share with you 3 important tips that I share with my patients to really help not only educate them, but to really help them achieve the best possible outcome after this surgery. So, number 1, the first thing that all patients should do before this surgery is prepare for the surgery. Now, this might include a number of things. So at home, you want to prepare your home. Preparing your home with food, stocking your refrigerator with easy to heat up or reheat nutritious meals, because you're going to be hungry and you're going to need to eat well to heal. But many people don't have the strength or stamina to stand and prepare a big meal. So that becomes number 1. Nutrition is important. The other thing is medications. I give all of my patients a list of medications that they need to pick up at the pharmacy that are over the counter, as well as sending in prescriptions for medicines that they might need. So this would be things like acetaminophen for pain control, a prescription anti-inflammatory, maybe a prescription for a medicine called Neurontin or steroids in some cases, and then a narcotic for breakthrough pain. We also recommend that people pick up an over-the-counter stool softener. And these are important things that you're going to be taking after surgery. You don't want to have to stop at the pharmacy on the way home from the surgery center. The next thing is clean up your home. So get rid of throw rugs, get rid of cords, get rid of things that are tripping hazards. This prevents injuries such as falls after surgery. The other thing that you want to consider, and not everybody will need these things, but based on your age and your functional ability, you might need things like grab bars to pick things up off the floor or an elevated toilet seat. If people need a walker, we typically dispense that at the pre-operative visit, as well as things like ice machines that you want to get ahead of time and make sure that you know how to use after the surgery. And the last most important thing that I think you need to worry about as far as preparing for surgery is what we call prehab or prehabilitation. This is doing exercises to strengthen your muscles and try to improve your range of motion prior to surgery, because you're going to need to use all of those things after surgery to get a good result. Tip number 2 to get a good result is doing physical therapy, but at the same time being mindful of listening to your body. It's extremely important to do physical therapy. You have to do these exercises to get good range of motion and to regain your strength. Now, to do these, it's also important to follow a very strict multimodal pain regimen. And if you've watched my other videos, this talks about a very strategic way of taking medicine around the clock, things such as acetaminophen and anti-inflammatories. We occasionally use other pills for nerve pain or steroids. And narcotics should be used really as an option of last resort for breakthrough pain, but not taken on a scheduled basis. In addition to that, the importance of icing and elevation and compression help control pain and help control swelling, which can allow you to get good range of motion. But you need to listen to your body. At no point in the early phases are you going to be pain-free. Physical therapy is going to hurt. It's going to be uncomfortable. So you have to learn, and a therapist can help guide you into what pain is considered normal and what pain is considered not normal. If you do not do exercise, your knee most likely will get stiff, and that stiffness will be painful, but that can also lead to permanent scar tissue, which would limit the range of motion for the rest of your life and probably will cause permanent pain. So when you're doing exercises, people will have pain. What many of my patients will find is that if you do exercises, it starts to hurt. And as you do more and more exercises and loosen up the knee, the pain will get less and less. And this might happen in 4 or 5 hours if you do therapy again after a period of rest. So you might have these ups and downs fluctuate throughout the day. And day to day, on average, you should see pain improve and swelling and range of motion improve. Now, sometimes, and every patient is different, what you do might cause extreme pain. So this is pain that is out of proportion. This is pain that might be from pushing too hard or too fast or doing too much walking or too much strengthening. Every patient's going to be different, but you have to be mindful of what your body is telling you, because if you push too far, this can result in an inflammatory response, which can cause more pain and more swelling, which can actually drive your recovery in the opposite direction. One of my previous patients, I think, described it best, and he's a physical therapist. And he said, when you're healthy, you can really push quite hard and exercise quite hard because your body is healthy. In 24 hours, it will restore itself. You would get back to normal or your baseline. When you're recovering from trauma or an injury or a surgery, you have to be a lot more cautious. There's less wiggle room. So you need to make sure that you're making progress in the right direction. But if you exceed the limits, it can actually drive you in the opposite direction. And this is where a good physical therapist is going to help guide you into knowing when what you're doing is causing pain, but that's normal and expected, versus doing too much and you're causing significant pain, swelling, inflammation, which is a sign that whatever you're doing for right now is too much. Tip number 3 is to have support. I typically recommend to my patients that before surgery that you find a coach. This might be a friend or family member, somebody that is there with you at all your pre-op and post-operative appointments. They are your extra ears and eyes because there's a lot of information that you're going to get from your care team. This also holds true for home, having support from friends and family when you're at home recovering. Not being out of the house, going to outside events can give you this sense of loneliness or loss of independence, and having friends or family come over and spend time with you at home can help ease some of that. And you might also need help preparing meals in those first couple days. So having someone to help you with meals and to sit and enjoy a meal in your home can be helpful in your recovery. And lastly, don't forget the importance of the support that you get from your surgeon and their nurse and your physical therapy team. Your entire care team is there to support you through this difficult process. And their goal is the same as yours is to get you better, to get you back to doing the things that you enjoy. So, in conclusion, just remember that this is a difficult surgery and this is a difficult recovery. But if you remember, you must have had pain for a long time, and your quality of life was impacted by your knee arthritis, and the conservative treatment options failed to relieve your symptoms. So now you're in the thick of it. This is a 3 or 4 month recovery, but the goal is to get your life back. It's getting back to the things that you enjoy. And this is going to require you planning preoperatively for the difficult recovery, having a support staff in place, and listening to your body while at the same time completing your physical therapy milestones to achieve the best range of motion and to achieve a good result after your knee replacement surgery so you can get back to living your life. Until next time, thanks again for watching. I'm Adam Rosen.